I'm Lynn Balderstone. This is my licence with my identification on it. And today I'm recording session assignment 5, Cognitive Behavioural Therapy. This is Kelly. Kelly has agreed to come today and be interviewed for this task. Is that correct, Kelly?
It is.
Thank you. Okay. Can you tell me what you come to see me about today, Kelly?
Sure. So, some good news.
Yes.
Been working really hard at work and recently got promoted, which is fantastic, except for the fact that part of my new role requires me to present to a board of 16 people every quarter, and I don't do public speaking at all.
Oh.
It scares the pants off of me. I absolutely hate it. I have no idea how I'm going to get through doing these presentations every 12 weeks or whatever it works out to. So I've got about 6 weeks.
Okay, until your first presentation. Right, so you've been promoted, which is fantastic. Congratulations.
Thank you.
But you're here today because you don't cope very well with public speaking or speaking to large groups. Can you speak to someone one-on-one?
Yeah.
Oh, okay. So you get along one-on-one. How do the people at your work sort of feel when you're talking to them one-on-one? Do they make you nervous at all, or are you quite confident of
No,
the one-on-one?
I've never had a problem one-on-one. Probably the only time where I get nervous with someone one-on-one is like someone from senior management.
Okay.
But other than that, you know.
So your fellow workers,
Yeah.
you're fine with one-on-one, not a problem. And so you've got 6 weeks now. We've got 6 weeks to work on this, and it's 16 people. That was what you said.
Yeah, a board of 16.
16 in front of your group of managers. Is it upper line managers? Okay. All right. So, how many people do you think you would be able to speak to at once? You've never done more than one-on-one? Have you ever?
No, I've only ever probably done one-on-one performance reviews with people.
Okay. Yes.
I haven't really ever had a need at work to talk to any more than just one other person at a time. Maybe, you know. Yeah, no.
No? Okay, how long does your presentation go for?
I think it'll take about 30 minutes.
About 30 minutes, okay.
I haven't fully developed it yet, but...
Okay, so what bothers you the most? Is it the length of time you've got to talk for, or is it the amount of people you've got to have in the one room with you?
Probably more so the number of people.
Okay. So the time's not really an issue. You think if you could get to the 16, you could get the time, wouldn't really bother you. It's the amount of people you've got to deal with.
If it was just a case of walking into the meeting and introducing someone, I could probably do that without nerves taking over, maybe.
So when you say nerves taking over, what sorts of things happen to you when...
I get butterflies in my stomach.
So I start sick.
Yeah, I start sweating.
Sweaty.
I get cold, clammy hands, so I hate if anyone wants to shake my hand. That makes things
worse. All right. And when you say you get sweaty, is it like quite a visual?
Yeah.
Okay.
So it's like sweat pours out of me from everywhere.
Have you played sport?
Yeah.
Okay. What sport do you play?
Netball.
Netball.
Yeah.
Okay. And what position do you play, can I ask?
Goal attack, goal shooter.
Okay, so you're kind of down one end of the field more than the other. Have you ever played in the middle of the field?
Probably when I was younger.
Okay, and when you were younger, do you remember, like if you played centre, when I played centre, you had to talk to everybody.
Yeah.
How did you go with that?
That's okay, but it's probably more like it's a bit different context.
All right, okay, because you're not the boss. You
Yeah.
kind of were, you probably just didn't see it like that.
Well, and it's usually like pretty short, so.
So, all right, what do you think? So you've got 16 people. let's work on the amount of people. You've got 16 people that you've got to accommodate in your meeting. So what if we sort of had a look at maybe trying to work on building up to those 16 people? How would you feel if we, say, put together, you talk to, say, a couple of people at work and you try and do that for maybe 10 minutes, take them into a room, maybe just talk about work, doesn't have to be, you're not telling them off, try and maybe choose a few different people out of your work colleagues, or your workers, to get in and have a bit of a conversation about something to do with work, so that you can then see how you go with a couple of people, okay? And then maybe we could work up to, what would you feel, where would your halfway mark be? What would you need to do by the halfway mark, which is what?
Well, if it's 6 weeks to the presentation, that'd probably be about 3, but I guess I don't really understand why I would do that.
Sorry, you don't understand why you would?
Why would I do that?
Why would you work on halfway?
Yeah.
Okay, if we can get through the 3 weeks, we could then have, if we get to 3 weeks, we could have you maybe dealing with maybe 8, maybe 10 people at 3 weeks, and that would give you a bit of a marker about how you're going to go towards your 16-week mark.
Right.
16 people at the 6-week mark. Do you follow?
Right. Yeah, sort of.
Okay.
So I guess the idea is to try and build up slowly towards the number of people that I need to talk to.
Absolutely, yes. That would be the way you would need to, I think, that would be a good way of you. How do you feel? Do you feel that if you could get to perhaps deal with 10 people in 3 weeks' time, that you might be able to get to the 16 people in 6 weeks' time?
Yeah, I can see a little bit. I can see the
Kind of
sense
see
in it
the
now.
sense in what I'm saying? Yeah. So do you think that we could perhaps go and make an appointment for next week, and then you would be able to perhaps get 2 people, and as I said, don't make it the same people, do it a few times. You've got a week before you come and see me again. So get hold of those couple of people, take them in, talk for, say, it doesn't have to be for half an hour, just 10 minutes, even 5 minutes to start with, and then move them around, get another couple of people in, because now you can sort of say, well, you've got 4 people then. Even though you did them 2 separately, and you start to tell yourself that you've dealt with those 4 people even, that will give you a little bit of a strategy towards when we come back next week, and perhaps from next week we'll try and make it that you get 6 people together. And so you're following where I'm going with that.
Yeah.
And if we can then maybe even lengthen that a little bit of time, and maybe the other things we can think of is, as we're going through these weeks, have you ever done any breathing exercises when you get a bit nervous? Perhaps when you're dealing with these people, perhaps try.
My normal thing is I just get nervous and run.
Well, maybe if you try to just count to 5.
Yeah.
And while you're counting to 5, just breathe in through your nose and out through your mouth, and that might just help to calm you down a little, settle you. And I guess when we get to your big meeting at the end of the 6 weeks, having a strategy in place so that you can perhaps have one person who might be a bit like a helper for you, who you could have present part of your presentation, if that's at all possible, or perhaps if you get you're really not coping, you might be able to step out of the room, just excuse me for a couple of minutes, and just go out and contain yourself with a few of those breathing exercises and be able to come in. Okay, is that a thought? Maybe you could see how you go with, when you get up to about 8, I'm hoping you'll just breeze this through, because you'll be able to say, I've done it with these people. Okay, how do you?
So I guess, let me just, so over the next week you want me to go and start presenting to some smaller groups of, say, 2 or 4 people, depending on what I'm comfortable with.
Yes.
And using that breathing technique when I start getting anxious and nervous about things.
Absolutely, yes. So we'll write this down for you. So we know that the worst scenario is those 16 people. okay, 6 weeks. So we want to try and have at week 1, you talk to 1 to 2 people. If you feel like talking to 3,
Yeah.
by all means do it. Do it a few times, maybe for just 5 to 10 minutes, okay? So we'll write that down. And then you're going to come back and you're going to use your breathing. If you feel a little bit stressed at that, just to help calm you down. And then we're going to come and see me next week. We'll make an appointment for that. So I'll give you those paperwork to take with you when you go today.
Yep.
And we're going to see you next week.
Okay.
Okay.
Great.
Thank you very much, Kelly. I'll see you next week.
Okay. Thank you.
Okay. Okay. Now my rationale, my technique was to use a cognitive restructuring technique with Kelly to try and minimise her anxiety by shortening the amount of people that she needed to deal with over the ensuing 6 weeks that we've got, slowly building that up to get her to achieve her 16 people in a 30-minute meeting. I think some of the things that I could do further to helping assist somebody with this sort of anxiety issue is perhaps using a diary. Somebody in this position, as Kelly is, would certainly be used to using a diary with their daily routines at work. So perhaps getting them to jot down some things like how they felt before, during and after their meetings with their smaller groups might be beneficial for her to be able to reflect back, and also for her to bring back to future appointments so that we can both address some of the feelings that she and emotion that she might have and put actions to those feelings for her next visit to her work. And I think that's pretty much it. Sorry about the child coming through in the middle, but it's really hard to do this here sometimes because this is the only person I've got to do this with, and she has a family of young little ones. Thank you very much. Bye.